Good morning, everybody, and you're very welcome to today's webinar. We're delighted to have you join us today. On our topic today is coronavirus supporting vulnerable people, and it's great to see such interest in so many people here today. So thank you very much for joining us. Before we get started, I'd just like to do a little bit of housekeeping, if I may. I'll introduce you to the panel on the right-hand side of your screen, if you've not already seen it before. And if you could just quickly do an audio check for me and raise your hand so I know you can hear us. While you're doing that, if I could remind you, in the same panel, if you could ask questions throughout the webinar, and we will have plenty of time at the end of the webinar to get answers to those questions. They are nice and interactive today, a couple of polls and a survey, and we aim to have you on your way by 11:30. And also just to let you know that the slides that you're seeing today and also the recording will be sent to you in a follow-up email. And also, as you can see there on the screen, we're working from home today, so if you do hear any delightful children in the background, I know you can bear with. Excellent, great. Okay, so I'm delighted to introduce today's speakers. We have three excellent speakers for you today, and I'm going to introduce them to you now. Devon Galani from Policy and Practice. Do you want to say hello, Devon?
Morning, everyone.
Thanks, Devon. Frank Curran from RedQuadrant. Would you like to say hello, Frank?
Morning, everyone.
Lovely, Frank. And also John Mortimer from RedQuadrant. Do you want to say hello, John?
Hello there, I'm John.
Lovely, thanks very much. You'll be hearing from them shortly. So just before we get started, I just wanted to say a little bit that we are living in unprecedented times, and it is thanks to organisations like you that we will get through. So I just want to start by saying thank you. By way of quick introduction, if you've not heard of Policy and Practice before, we help organisations to give the best support you can to help people on their way, and we're here to help you, and we will do that in any way we can. So what we're going to be covering on today's webinar, Devon's going to talk about the agenda shortly, but you may remember as part of the registration process for this webinar, we said that we would talk, what you wanted to hear, sorry, was to talk about local authority plans and best practice, who is vulnerable and how you can support those people, what impacts on support, collections and housing teams there are. So that's what we're going to be talking about today. I wanted also to mention right at the very beginning that we do have another webinar very shortly, specifically on how people can access their benefits. And on this webinar, we're going to be summarising the main welfare changes that have been made to date. And of course, it's a very fluid situation. Our Head of Policy, Zoe Charles, will be running this webinar. We'll also be talking about how people can access their benefits and the latest information and tools to share with residents. So it's just to let you know that that is coming in a week or so's time when it will have up-to-date information. Great, so that's enough from me. And at this point, I'm going to hand over to Devon Galani. Over to you, Devon.
Great, thank you, Janet. I just want to add to Janet's word of thanks for taking the time out to join the webinar. We know how busy everyone is right now, and we know how focused you are on helping others as we are ourselves. I think it's just worthwhile taking a moment to reflect on how lucky we are to be in a position where we can think about helping others. And I'd also like to say a huge thanks to the Policy and Practice team who have put together the web of resources to support people who have been impacted by coronavirus or the measures being put in place to contain coronavirus. We've seen a huge, unprecedented demand for some of our benefit advice pages and information, and we hope they can be put to good use. What we're going to cover today is, I'll cover very briefly because there was the demand from those attending the policy measures that have been put in place to protect people. As Janet said, we'll be covering that in more detail in the webinar on the 8th as more measures are being announced almost daily, it seems. Today we're going to focus much more on what organisations are doing to respond, particularly local authorities, but also how they're working with the health trusts, the housing associations, the voluntary sector around this. And one of the reasons we invited Frank and John to join us is because they've got the experience of helping local authorities on the ground in past emergency situations and even current. So I know John is working with a local authority right now in helping shape their response to coronavirus. So I thought it'd be helpful to kind of talk about what, for them to come in and talk a bit about how local authorities are thinking about that. I'm going to say a bit about how you can identify who is vulnerable. So I'll be talking a bit about how we've shaped our analytics, reshaped our analytics to focus on those groups most at risk from either coronavirus directly or from the economic measures being put in place to contain coronavirus. Then I'm going to hand over to Frank and John to talk about the so what of that. So, if you can identify vulnerable people, how do you engage them? What do you do next? And then I think we'll talk a little bit about, well, for those that can help themselves, how do you help them? And hopefully we'll have lots of time for questions and answers, because I do know, I do know how busy everyone is. We were thinking, actually, is this the best time to put on a webinar? I think it has been, actually, just we've had unprecedented demand, and there's a huge number of you on this webinar today. So do get your questions coming in. If we can't answer them right now, we will be collating them and putting them in a follow-up blog, or covering the key points in our follow-up email that Janet will send out today or tomorrow. So yeah, that's the agenda. I'll start with a summary of the measures that have been put in place. I'll start with one that isn't on this slide, which is the job retention scheme, or the employee retention scheme that's been put in place, which means employers can get support for up to 80% of their employees' wages, up to a maximum of £2,500. That's going to be very important. What we focused on here is the changes in the benefit system. There are three main changes and a number of others that are on the next slide, but I'll focus on the three main ones now. There's the basic allowance increase in universal credit and tax credits that has gone up by £20 per week. There's a change in the local housing allowance back to the 30th percentile of local rents. And universal credit awards for the self-employed will now be based on actual income rather than notional income, which will help those self-employed who are seeing a very sharp drop in their earnings. They'll receive much more universal credit as a result of this. We did do some analysis on these measures. If you've got the panel in front of you, on the right-hand side, you can download our report. There'll also be a link to it in the follow-up email, which breaks down the impact of each of these measures on different household groups and shows how big a benefit that will have. But in summary, what it means is that households in receipt of universal credit, you'll see kind of households struggling to make ends meet fall, because these measures do make the benefit system more generous. So we use a measure called financial resilience, looking at households who can meet their minimum level of outgoings. So 16% of households prior to these measures being put in place who couldn't meet their outgoings. After these measures are in place, that will fall to 10%. So that's helping, again, a large number of households. And the average increase in the universal credit award as a result of these changes will be around £98 per month, so an increase of 7.3%. But we mustn't forget that actually there'll be far fewer people in work as a result of this. So while the benefit system is becoming more generous, people's economic circumstances might have changed to leave them worse off. I think one extra bit of analysis that's worthwhile pointing out for the local authorities on here is the impact of the local housing allowance increase, as you will know, is varied hugely nationally because of the changing rates while the benefit freeze has been put in place. In bringing that back, we've seen sort of increases in impacts of about 2% in terms of housing costs in some parts, particularly some parts of the northeast, to sort of 40% in London and some other big cities. So the impact of that locally will be relevant to you, and if you want to find out what that is locally, don't hesitate to contact us after the webinar. Moving on, Janet. And it's just worthwhile pointing you to some of the resources. So on the bottom of this website, if you go to policyandpractice.co.uk/coronavirus, you can access our coronavirus information pages. They are aimed at your residents, your clients, your customers, as well as yourselves. So that's how we've written it. They're written to be accessible, and they're updated on the same day, in some cases within the same hour of announcements being made. And we know we're expecting a new announcement on support for the self-employed. So as soon as that's up, that will be on this website as well. We've opened up Q&A comments on this page. So we're getting literally hundreds of questions from members of the public, which we're doing our best to kind of group together and answer. in sort of a Q&A style. So on that page, you'll be able to see answers to some of the common questions that you'll no doubt be facing as well as us. And hopefully that's a helpful resource for you guys in terms of understanding what those changes are. Over to you, Janet.
Great, thank you, Devon. So it's at this point that I'm going to serve our first poll. So just bear with me while I get the technology right, and hopefully on your screen you should be able to see our very first poll. Excellent. Okay, so so the question to you is, what is your immediate concern today? Is it that you are worried about having too much demand for your services? Are you worried that you're not going to reach the most vulnerable people? Are you worried that people are going to exploit the help that you have to give? Are you worried about being too slow to get support to people fast enough? Or indeed, don't you know, there's just so much going on, it's hard to actually prioritise what is the most important thing. As with all of our polls, I do appreciate it's quite tough to choose one of these options, and they are just for illustrative purposes only. Yeah, it's just good to get a straw poll and just see what everybody is thinking about right now. So thank you very much. I can see all the votes pouring in, and I'll just leave it a couple more seconds longer as everybody is voting. Great. Now, so I'm going to close the poll now and share the answers on the screen with you. Great, so hopefully you'll be able to see those answers there. So in answer to what was your immediate concern, the responses are 52% of you are saying that not reaching the most vulnerable people is your number one concern, immediate concern. Secondly, at 28%, 28% of you are worried about being too slow to get support to people fast enough. And then thirdly, at 14%, you're worried there's going to be too much demand for our services. And just for completeness, 5% of you don't know, and 1% of you are concerned about people exploiting the help that you can give. So quite a resounding result there. Devon, over to you for comment.
Well, I think it's that's encouraging, I guess, in a sense that the content of what I'm covering on this webinar is how you can reach the most vulnerable people, and a lot of what Frank and John are going to cover is about how councils can be faster in getting support to people. So I suppose that's encouraging. Frank, John, is there anything? Do you have any reflections? Does that chime with your experience of what local authorities are telling you?
This is John here. Yeah, I think that there's one thing that I have on that isn't on the list, and that is what will be the demand tomorrow. So what are we going to be doing next week that we don't have today? So what can I prepare today for next week?
Great. I think that's a nice one to take away, and maybe we can reflect on that as we go through the webinar. Frank, is there anything you wanted to contribute?
I find it encouraging that people have not said too much demand for our services, because I think a lot of public services are set up on the presumption that there's a need for them to be rationed really tightly. I don't think rationing is the right response in this situation, and the fact that folk are saying that too much demand is not a huge worry for them, is actually quite a positive thing, I think.
That is encouraging, and again, really nice to see people aren't too concerned about exploiting the help we can give, because I don't think that is the right approach to be taking right now. Thanks so much, Janet.
Brilliant, excellent. Okay, so I think we should be back on the screen now. So if I move over to this slide, Devon.
Well, again, it might be a good time to bring John and Frank in, but I thought I would share some of the conversations of what that we've had. These are 3 of the councils I've spoken to just in the last day or 2. The team at Policy and Practice have had many more, so dozens of conversations. So I'll start with kind of the general view of what I think councils are up to. I think the first priority was thinking about housing and homelessness in particular, so where they could so finding places for people to live, ensuring that they felt secure in their home. I think a second big priority has been setting up home working. Some councils have been better set up for that than others, and those that weren't have had to kind of mobilise very quickly, and I think have done that admirably. I think the third big priority has been sourcing food and thinking about food distribution, which I think is still an ongoing thought and concern. for councils, undoubtedly. So those are kind of three other things. And I think the fourth thing, which is reflected in Sanjay's quote here in Haringey, who's socially isolated, who doesn't have access to the internet now, can we get that to them? Because actually this is a long period to be by yourself. Before I sort of comment on Sutton or East Suffolk's kind of comments, Frank, John, is there anything you wanted to say about how councils are responding generally? And is my summary a good reflection of what you're finding council's immediate priorities are?
This is John here. The list in front of me is exactly what people are saying in my council, but can I just emphasize that one council is made up of different services, and what we're actually finding is that each service has got its own questions, and it's important to allow those services to focus on those particular issues that they have. But I think that the one that you've just mentioned regarding Haringey is the big one, because we are not set up in general in the public sector to respond to those types of demands.
Yeah, absolutely. Frank, anything you wanted to throw in there?
I think that's certainly been the feedback we've been getting. I think councils are in particular concerned about the people whom they don't know about. I think that's the point, and that was reflected in the poll actually. But it is this sense that there's a large number of people out there who are vulnerable, might be socially isolated or whatever, but who are now going to need a council response and have not previously needed council support. So that is a kind of big emerging theme, I think.
Well, I'm about to go on to that, Frank, so thanks for the intro. I guess I'll just give a couple more shout outs. One to Rachel Acosta, who from Sutton Council, who Policy and Practice works with, who came to us with the question, we want to know who our vulnerable residents are. I've pulled some of this data out of Lift. Can we do X, Y, and Z? And it turned out that we could, and that's what I'll come on to talk about. So thanks, Rachel, for the inspiration. And I was on a call yesterday with Nick Khan of East Suffolk, and I was really refreshed by a couple of members of his team, one of whom said that they've mobilised for those that are working at home, who are doing jobs, can't do the jobs they used to do. They're mobilising them to do some of the outreach work, which I think is admirable. And I think one of the examples that was given was they've got people doing shopping and dropping around to people where that's what their immediate need is. And I think that kind of really practical example of being able to make a difference to someone is, I think a really, really powerful one. So 3 examples. I'm sure there are many more. Feel free to share your own with us. Janet, if you flick on. Sanjay shared this from Haringey. I thought it was worth sharing. He's happy for me to sort of share this more broadly, which is, I think, an illustrative view of how to prioritise some of that demand. I guess what I take away from this slide is, as I think John mentioned, just how complex the picture is. So we're going to talk about some models that try and simplify that, but I think it's worthwhile recognising just how many organisations councils are working with right now. The delivery arm of government, so working with central government, working with the health services and public health, who are obviously key to this and protecting us through this pandemic. But also the community and voluntary sector, who are there to help people either financially or with social isolation. I think this is a good illustration of just how complex that environment is. If we move on, Janet. So who is vulnerable and how can you identify them? So with a view to kind of simplifying that, Frank and I were discussing ahead of this webinar, the content for it, and we basically identified 3 main groups that you should see now. So I think there are 3 main groups that councils are thinking about. The first one of those is the shielded group, those that are more vulnerable to COVID-19 infections, so those with underlying health conditions, those that are over 70, that they want to just really keep away for the next 12, 13 weeks. And again, it's worthwhile reflecting on just how long a period of time that is. People's needs will change throughout that period. Then I think Frank brought into our thinking just the local authorities are thinking about the known vulnerable. That's kind of where most local authorities will be, those that they already know about within the adult social care service, within the children's social care service, or within the other services they provide, who they already know about and they have a duty of care toward. So that's kind of the known vulnerable. And as I think is reflected in the poll, thinking about the newly vulnerable, or those that are vulnerable that you don't necessarily know about, who may be facing a steep drop in their income, may be impacted by social isolation. Who are those households, and what can councils do to help? And I actually think this is quite a good model of thinking about it. It's clearly a Venn diagram. So some of those in the shielded group will also be newly vulnerable as a result of some of these changes, and you'll know some of those that are in the shielded group as well. So it is about bringing more of this together where you can. Moving on, Janet. So what we did, again, in response initially to the request from Rachel at Sutton, was to pull out some key groups and key groups that are at risk in one of those, in some of those 3 groupings. So there are 9 categories here on the left. So this is a dashboard that's being made live currently for all of our lift clients. We got the data set to them already, the underlying data set, but I think there is demand to be able to show this to people and illustrate really where those at-risk groups are to help with planning. So on the left, you can see in this illustrative example, 2,023 couples with school-aged children eligible for free school meals. So ensuring they can get, they've got access to enough food and they know to get that from their school. 1,472 couples with children under 5 who perhaps would be eligible for free school meals if their children were old enough. One of the things we can do is prioritize those groups by income. So you can kind of look at those with children under 5 who are struggling most and prioritize support to them. We've got the same categories for lone parents. Obviously, lone parents likely to be struggling more because they can't leave their children and go out and go to the shops. So it's worthwhile talking to them and asking them what support they need. Low earners and the self-employed, so households who will be getting some support, as we've sort of covered on the benefit pages, but perhaps not as much, and making sure they know what they need to do to access that support might be a service you can offer them. Households with low earnings who wouldn't qualify for statutory sick pay because they're on 0 hours contracts, 2,430 here. Then there's the living alone cohort, so 5,962 pensioners living alone. Again, they can be sorted, they can be prioritized by age or by other conditions or by income to help you to focus your support on those that need it the most. 3,522 working age single people with limited capability for work-related activity or care or mobility issues. And 13,000 other single people that are perhaps lower down the priority list, but actually if they're flagged up on if they have other indicators of vulnerability, you might want to sort of reach out to them as well. And you can see how that's illustrated. So you can see immediately where your hotspots are, where you might want to focus your community hubs, your outreach work in that map on the right-hand side. So you can see which wards are getting the most. You can actually click on one of those wards and see what the numbers on the left would be for that ward specifically. So it helps you to get that information to councillors, members, and to help with your local planning too. And the page also has support tools. So a link to our coronavirus support pages, a link to the benefit and budgeting calculator, which can pull the data in, so individuals aren't having to enter that data again to see what support they're eligible for, and the ability now to chat online with other lift clients, which we've seen really high level of demand for. We've started chatting to them already in our online community, so and I think they're finding that really, really valuable. Moving on, Janet. So really what we've done on that first slide is take your data and put it into a shape that can be updated easily and is made relevant for coronavirus. I think some of the value added work we do on top is we allow you to kind of take that data, drill down to individual households and start to focus on other things. So you can start to, so we've highlighted here the fact that you can identify what benefits those households might be eligible for that they're not currently claiming. You can focus on and prioritize those groups as I was describing earlier. So you can focus here, as you can see at the bottom, on families with children or families with young children or a whole host of other categories. And financial resilience and debt, so you can prioritize those by those that were struggling more before, because again, you might not have the resources to reach out to absolutely everyone. If you move on to the next slide, actually, I think we show the financial resilience subgroups. So you can focus on those. For example, you can remove from the list those that are coping. on the left-hand side, so those that were able to make ends meet before this crisis hit. You can also look at those that might be in rent arrears with the social landlord, or in council tax arrears for those in the private rented sector, to see who was struggling more beforehand financially, and make sure that they're getting the forbearance they probably need and the reassurance they need during this time. And then it's possible to click on one of those households, as you can see on the right hand side, and then drill down to see more information. So if you move forward, Janet, you can see, so we've drilled into one of those households. On the left hand side, you can see you've got a couple with 5 children who were in work. You can see in the middle that we're able to track changes in their earnings. So their hours worked has gone down from 37 to 25, and could well go down again in light of the pandemic. And you can also see the support that they're eligible for on the right hand side. So you've got the potential to write to them and give them information on support they could be claiming, like a discounted water tariff or a discounted energy bill. You could do that kind of the data, the analytics within Lift that powers this allows you to identify exactly what support they're missing out on. And the other thing we do is we take into account those measures as they're announced. So from April, the measures coming in April 1st or April 6th, we'll be taking those measures into account and reassessing eligibility based on that new criteria. For the data sets we'll be refreshing in April for our local authority partners. So that gives you an illustrative view of how you're able to identify households affected by coronavirus, either directly or the measures put in place to contain it, and what you can do to engage them. Janet, if you move forward, I think now's a good time to hand over to Frank and John to talk a bit about the so what of that. So once you can get that, what do you do next? Frank, over to you.
Okay, thank you, Devin. Janet, can you move on to the next slide? Thank you. Right, I suppose what we wanted to talk about here was the so what. So in the sense that you've identified vulnerable people, what should be the response, effectively how to use the policy and practice tool to identify vulnerable people and respond to their needs. So we're basing this on direct experience of work that John has been doing with one local authority, plus conversations that we have had with our broader client base. We're a management consultancy. We work in transformation across the public sector, including many local authorities. So that's kind of the basis that's where we're coming from. So one of the things that's clear is that councils and other organisations such as housing providers, citizens advice bureaus, etc., are already experiencing considerable demand from vulnerable people. So I think what this does, or the focus of the kind of tool that policy and practice have, is that it enables identification of people potentially most at risk. Thus, effectively, it is creating opportunities for prevention and early intervention and targeting those people whom you might otherwise miss. So there are 3 ways in which that can be done. It can be done by targeted communications to those at risk as a whole, letting people know you're there to help and how to contact you. It can be done by targeted communications to individuals, so proactively contacting individuals most at risk to check on their welfare. It can be done with targeted communications to localities by working with social landlords, charities, and other organisations to alert them to potential hardship. So the kind of example of that Devin showed earlier on regarding ward-based information to be used in that way. This tool needs to be used alongside other channels such as advertising to effectively make sure you're reaching the full gamut of vulnerable people. All of this is going to generate demand for services. So the question therefore is, what should the response be? So Janet, can we move on? I'm going to hand over to John in a minute, but I'm going to start this part of the session with an anecdote from a colleague who had a vulnerable father in the north of England. He was concerned about his father. He phoned up the council 2 days ago, got a response back in 4 minutes. Very warm, very friendly, very high quality response in how they responded. What they offered was they would send a team round to do an assessment. So 10 out of 10 for the manner in which they responded, 0 out of 10 for what they actually responded with. A team to do an assessment is not the answer in this situation. So having framed it in that way, I'm going to hand over to John to talk about the work he's been doing.
Thanks, Frank. So last Friday, I was doing my usual, which is I help organisations with understand complexity and help them redesign their services. So on Thursday, that's what I was doing. On Friday, they asked me to facilitate their new hub that was there to respond to the new virus problem. So we had a group of people, we have a group of people who are in a room. So we have 5 leads in a room. We have someone who is there leading on the support function. We have someone who is focused on collating and connecting to community groups and to ensure that we have a food logistics flow. We have someone who's focusing on partners and agencies that we traditionally have been connecting with already in the past, but we need to work with them more directly. We have someone focused on looking for and mobilizing volunteers in the wider public, and we have someone who we have realized that we needed to focus on the website and on the intelligence that we are gathering through the data. And what happens is that we set ourselves up on the Friday. We didn't know what we were there for. We didn't actually know how to do it. So the Friday and some of Monday was, what on earth are we here to do? And the first place that we started was to listen in to the calls that were coming in and understand. We went around all the services and asked them, what is going on in your service that is going to be impacted by this? What we then did is that we then created some basic flows, and in particular one main flow, which is help me, and we put someone in charge of that, and we set up staff that were working from home to effectively take the 2 ways they come in through customer service and on a call, and if customer service can't answer that call satisfactorily, they will pass it on to us through a form, through a traditional referral, and then that gets passed on very quickly to someone who's working from home, who then calls that person back and tries to get an understanding of what that person's needs are. And then we have, once we've done that, what my role is to, well, I have several things, but one of them is to sense what the new system that is emerging, what does it look like? Who do we need in place? What's working, what's not working? I need to focus on the end-to-end. So I am going around the council 2 or 3 times a day. I'm visiting customer services to make sure that everything is flowing well. At the moment, which is the last time I saw them was yesterday afternoon, the flow is working. It's not particularly efficient, but it's working, and the role that I also have, and possibly one of the most important ones, is to remove the barriers that people have, because once someone is sitting there in the hub trying to mobilize their staff, they are not able very easily to stand back and understand the whole situation. So I think I'm there to help the communication and see where we're failing, both within ourselves as a team and our connections to the other services, but also where we might not be achieving what we're meant to do for the people. So our purpose really is to support people in whatever way. On Monday, we thought we would have a major charity that would be taking food from supermarkets and to then distribute those. We then discovered over the last couple of days is that they're not able to mobilize, so we've had to mobilize our own staff to do that. If you could go to the next slide, Janet, please. So what we have understood is that this is all about complexity. This is about moving forward with in a direction that none of us know what the next step is. So with the background that I have, I'm able to help everybody to give confidence to move in a direction that they are unfamiliar with, and to pull all of these things together rather than dump a bunch of people in a room and for a senior manager to come in and say, this is now your task. And in particular, the thing that worries me is where are those vulnerable people that today are not vulnerable but tomorrow will be more vulnerable? And what will we be doing next week that we're not doing this week? So that's kind of an overview of what I've been up to. So over to you, Frank.
I suppose the key point and the key learning, I think, in terms of how people have responded to this is that this is, as John just said, this isn't a problem that's going to be solved by top-down approach. This requires an approach that will try things, see how they work, and adapt on the basis of learning. So the components of the response are actually fairly obvious. You've got repurposed staff in councils who are often frontline staff. You've got a basic process and a basic flowchart. You need clear feedback and learning loops to deal with emerging needs and process gaps. And as John says, to start to anticipate the needs that might be emerging in the next couple of weeks. You need mechanisms for referring more complex cases, and you need something around arrangements for accountability, reporting, and safeguarding. But the point is, this needs to be done. The kind of response needed is something that is quite simple, is quite iterative, is about trying stuff out, seeing if it works, and adapting on the basis of learning. So that's the kind of key learning, I think. So what is needed to make this kind of approach work? These are obvious points, I think. There's a kind of community resource map to identify food banks, volunteers, etc. That information will be held, some localities will have very up-to-date information, some localities will have much less information, so it needs to be up-to-date. There is a point about training and asking staff to help them to engage with people in a different way. So in local government, we are, in particular, in public services, we think about assessment, we think about eligibility, we think about criteria, we think about legislation and regulations. Those things matter, those things are important, but those things can also get in the way of connecting people with needs with people that can meet those needs. So there is a different approach that is needed, I think. Coordination is important. Volunteering is becoming a major feature of the response to this crisis. The enormous numbers of people who have volunteered for the NHS is one example. There are volunteer programs run by Red Cross, run by NAVCA. There are 2,000 community groups around the country. So there's a lot of people that want to help here. So how do you, as a local provider or a local authority, utilize that enthusiasm and that goodwill? There's some policy issues around eviction, and homelessness that I think are important. There are, which are possibly not immediate, but they will become very important. Local charities and self-organizing groups will have various ideas to help reduce social isolation. So helping to install apps such as WhatsApp, Skype, etc., online book clubs. And there are various cheap, accessible technology solutions. There are lots of other things that could be included in this slide. You could have this 10 slides covering this. But I suppose the key point that I'm trying to make here is, if you're a local authority, you have got an immediate need, you need to respond to that immediate need. And I think in a very proactive kind of way, if you're a local agency, I don't think you can expect the local authority to take the lead for you. I think you need to be thinking about how you organize yourself. And I put at the bottom, ask for forgiveness, not for permission. It is better to try things out, to try and meet needs here, and without waiting for someone to invite you to do so. So that's my kind of core message, my core point, I think. I put contact details if you want to help setting up your response. We are happy to talk further. We're also setting up learning together groups as places for people across public services to share urgent learning on dealing with the COVID-19 crisis. So I've put the links there and they'll be in the pack that Janet will send out. So back to you, Janet, I think, yeah?
Yes, indeed. Thank you very much, Frank, and also thanks to John as well. I think that was extremely interesting. I hope it was very useful. Moving on now to our second poll, I suppose to bring this section to a close. What's stopping you? It sounds a little bit aggressive. It's not intended, but what are your barriers? What's stopping you from getting support to vulnerable people? So let me just launch that poll on the screen for you now. Again, as I said earlier, it could be, appreciate fully that it could be a combination of these factors, but what we've put here, we're interested again to see what's the main thing that's stopping you getting support to vulnerable people. Is it a cultural issue? Some of the stuff that John and Frank talked about there, silo working, ownership, collaboration between teams. Is it about the resources, so people, time and money? Was it about not having the insights, stuff that Devon was talking about in terms of identifying people? Is it that actually too many people need your support? So indeed, where do you start? Or is it more about home working coordination, restricts on travel, face-to-face meetings, that kind of huge shift that we're all feeling in terms of restrictions? So thank you very much for those of you who've already voted. It's great to see the votes coming in. Please do keep them coming. As I say, I appreciate that there could be a number of different combinations on this. Great, thank you. I'm going to close the poll there now because I'm conscious of time. I want to make sure that we have plenty of time for the questions at the end. So do indeed put your questions in the panel. So hopefully you should see here on the screen now the answers to this poll, and as with the other one, it's quite telling. There's no doubt at all. So 57% of you are saying that the biggest barrier, the biggest challenge that you currently have in terms of getting support to vulnerable people is the home working coordination, restrictions on movement and travel. 18% of you say it's lack of insights. 10% say it's culture, and equally 10% say it's resources, and 5% say too many people need your support. But I think a very telling response. Over to the speakers for a comment on that. Devon, do you have any reflections on that?
I think I'll let Frank and John reflect first. They might have some thoughts on setting up for home working and dealing with that shift.
It's John here. That's an interesting one, 57%. I haven't seen that as being as important with the organisation that I'm working with. We have had people working from home. We've had to get very good at using conference calling and to actually get people back into the council when we need to. So we thought we could have more people working from home. We've actually had to pull more people back in to be able to coordinate and talk to each other. But I think the key to this is actually having the right people within the building that you need, and trying to support the people that don't have the work they originally had to do to repurpose them into supporting this.
I think I would add to that. I was surprised by this response. I thought it would be, people would be more concerned about resources actually and culture, but it is it's very interesting. I think the encouraging thing about that response is there are ways around that. There are ways that you can coordinate online. We all know, I mean, there's quite several hundred people on a webinar at the minute. So, you know, it is perfectly possible to coordinate in this way. I think what is slightly more challenging is those people whom you are repurposing, those people who perhaps have had one role, you're asking to take on a different role. How do you train and induct them effectively? But again, there are lots of online tools, we're all familiar with them. So I'm interested to, yeah, I'm slightly surprised at that one. And it's
I guess if you've got, for those of you that entered that home working coordination restrictions on travel, if you want to sort of add flesh to that, you can enter it into the chat box or in the as part of your question. So if we're not sort of answering it in the right way, do come back to us on it, and we'll look at it in a bit more detail. Frank, I hope I didn't cut you off there.
No, it's fine.
Great. Just to add my thoughts on kind of repurposing, the couple of organisations that have mentioned that to me has been, actually there are people who were doing a job that they can no longer do because of the restrictions on their travel. What do we do with them? And I think the example I gave was in East Suffolk, where they've been able to repurpose some people to do some of this outreach work, picking up the phone where they've got contact details, getting contact details where they don't have contact details. And I think the other sort of thing underlying it might be just the inability to pop round or see people. Obviously, we all need to follow the health guidelines, but I think as the 12 and 13 weeks pass, the potential to, if you've identified households that you think are particularly vulnerable that you've not been able to reach, popping around, knocking on they'll be in at the very least, so it won't be a wasted visit, and standing back 2 meters, but just saying, actually, we're just checking in on you. Is there anything you need? That's not that's not beyond the realms of imagination and could well meet public health guidelines, but that's something for you guys to look at yourselves. That's just me throwing in some thoughts. I think before we move over to the Q&A, so do get your questions in before that. One of the things Frank and John mentioned was, in doing this, in kind of looking at who's vulnerable, and if you're successful in identifying them and contacting them and letting them know you're there to help, you will increase the demand, inbound demand coming in. So how do you successfully triage people and point those that can help themselves in the right direction, so you can focus your attention on those that are likely to need a bit more support, because you will be overwhelmed. I mean, that's the other feedback I've had from councils, the team at Policy and Practice have been speaking to, is just the demand. And we've seen that ourselves, so have you, undoubtedly all of you on the webinar have seen an increase in demand for queries, and we saw that DWP have been overwhelmed by 500,000 new claims to universal credit in the last 10 days. We've seen the spike in demand in people coming to our website and our information pages. So what do you do about that? I've referenced before, you can point people toward the Policy and Practice /coronavirus page to go to for information. But Janet, if you move forward, the other thing that you can do is the benefit and budgeting calculator, which we have as a tool that's linked to you from gov.uk, you can put on your site directly. So you can see here an example here, the logo on the top left-hand side is with Vivid Homes, who have a self-service calculator. It points everyone on their website to go to the Your Income and Coronavirus pages if they need to. In the bottom right, you can see that there's a little chat box so they can contact us. So if there are if they've got questions about what to do next and what to claim, the team at Policy and Practice can handle those. But if they want to get in touch with the organisation directly, in the top right, you can see a Send to Advisor button, so they can complete the claim form, hit Send to Advisor, contact someone, and say, actually, be explicit about what help and support they might want and need in that Send to Advisor email, and let you know how to contact them as well. So hopefully that's kind of a powerful tool that some of you are already making good use of. The other thing it does, as I mentioned, so this is updated as each change comes into effect. That change is updated that day, so it will reflect the increased benefit rates and other measures that I described in the early slides. But it also carries out an assessment based on the information you've entered on support you might be missing out on. So households that should be getting food vouchers but aren't, while you are being proactive in contacting people or reaching out to people, do make sure the support you're offering them is as holistic as possible. And this is a tool that helps you to do that, because once you've captured that once they've completed the information, the analytics behind it does this assessment around whether or not they should be getting free school meals, free prescriptions, lower cost utility bills. We're actually talking to all of the energy and water companies right now to say what their processes are. So you can we'll be able to point you to how to get in touch with them to help your residents, and what your residents can do to access the forbearance that the government has said will be in place by those organisations. So it's got that eligibility built in, and again, we've seen a huge demand. The team are working around the clock really to get this up and running, often within the same day, or we're talking within days rather than within weeks. So if you do need this support, but you're worrying it'll take a long time to get it set up, again, the team are there to make sure that's not the case, and we can get this or the analytics up and running for you in as I said, days rather than weeks. We're fully focused on how we can be as helpful as possible to you. So without further ado, let's see what questions you've got. Janet, do you want to host these?
Yes, indeed. Thank you very much, Devon, and thank you everybody for the huge number of questions, unprecedented, and I do hope we pick out a couple of really good ones here. The rest of them we will answer offline and follow up to the webinar if I don't get to yours. But just to pick up quickly on one of the points from the last poll, this person says, "Hi, I mentioned home working not because my team are struggling with this, but because our clients' demographic is shifting as some are no longer able to communicate with us effectively due to digital exclusion." So that's an interesting point there as well. In terms of questions, if there's been a couple here around about GDPR. So Devon, I don't know if you wanted to just Devon and Frank and John, if you wanted to quickly say something around GDPR and the use of data in these circumstances. Do you want to answer that one, Devon?
I'll happily take a first pass. Do feel free to sort of chip in from how local authorities are thinking about it, Frank and John. The normal basis by which we're working with the data we use is basically stipulated in the Welfare Reform Act. So we rely on the legal basis and permitted purposes for the data sets that we are working on. And that's what we are continuing to do, because effectively we're helping to target welfare support to people that need it the most. So we're continuing to rely on that legal basis. We were asked about how you can use this information, how you can share it with others, and generally councils, you know, if they've got an agreement in place with an organisation, they might feel that that's something that's appropriate. Where they don't, they tend to struggle in normal times. And I think that's probably a good tenet to stick by. But it's worthwhile. We were looking into this. We were asked this question by one of our clients, and the ICO does make reference to emergency situations where effectively it's up to the data controller, so in this case the local authorities data that we're working with, to make a judgment on whether the use of that data is proportionate in being responsive to that emergency situation. And I guess if you think it is, then you've got a case, you've got a strong case to be able to use and share that data. I think now isn't the time to, like, talking to other authorities. You obviously need to take care of data and treat it responsibly, and we at Policy in Practice take it incredibly responsibly. But now is not a time to be, I don't know how to put this. Local authorities have found it refreshing, despite the challenging circumstances, the amount they've been able to achieve in a short space of time. And I think staying focused on that is the right attitude and approach in this circumstance. John, Frank, do you want to come in?
Yeah, Devon, I have just very quickly. I find that most public sector organisations tend to over specify GDPR and data protection. So when we've got an opportunity here, I'm able to help them to understand. For instance, we've got volunteers that aren't part of the council out there. If we connect with those volunteers are now acting on behalf of the council. They become part of that one organisation from a GDPR sense. Therefore, I'm able to help them cut through that. When I explain that to them, their shoulders fall back again and go, okay, that makes sense. Yes, we're going to go ahead with this. So actually, one of my key roles is to help them navigate through risk, and most of the people I'm working with have never had to make those decisions themselves. They've always had other people, or they've had procedures, and it's important, this I think is really important, have someone there that can navigate through that perhaps is used to working quickly and effectively and understands the legislation, but actually understands that in a situation like this you can actually go through it with a set of scissors that can make you and others behave in a different way.
Excellent, thank you, John. Just sticking with the point around data, this attendee says, we are clearly in a period of flux. Can you recommend a way to collect data from this early stage so that we can accurately identify the impact coronavirus has had from the start? I'm not quite sure who wants to take that one.
Again, probably one for me to come in on. I guess for the clients that we've been supporting for a long time, one thing that we're able to do, and again, you can see it if you look back at the slides on the one where we drill down to the individual, we're able to track households' changing circumstances over time. So we're able to see from month to month so if you've got an influx of new council tax support claims, for example, in April, you'll be able to see that, and you'll be able to see who's newly claiming, who's newly on that list. Yeah, so that's kind of one way of doing it. Equally, I think it's worthwhile recognizing I've seen some really good work by local authority data teams, directly those that are sufficiently well resourced to do that, who are kind of working quite hard to put their own data sets together and look at that directly. I think if you can do that, I think that's absolutely brilliant, and we're here to support and partner those local authorities in doing that. The other thing is staying on top of changing legislation, so being able to use that data in a way that reflects, the very fast-moving, as the questioner said, a state of flux of the policy environment that we're in. What is the impact of the additional £500 million local authorities have been given for discretionary support, or the similar amount they've been given to support council tax cases? How are local authorities going to administer that, and how should they do that? And using the data to do that effectively and seeing whether or not it's having an impact is another thing that we're able to do, because we work with the data on an ongoing basis. Again, Frank, John, I don't know if you've seen any good examples that might.
It's John here. One of the things that what we're really talking about is knowledge and intelligence. And I would just like to say that a lot of that resides in people's heads, and it resides in the calls that are actually coming in. So physically go to the contact center and ask them what calls are coming in today, how many are coming in, have a flip chart on the wall that tracks that. So I know that wasn't the direct question, but I would suggest that you have to do that in addition to the data that you already have. I
think that's a great insight. Thanks, John.
Excellent, thank you. I'm very conscious of time, so I'm going to try and get 2 quick questions in, if I may. The first question here is, please advise what possible support might be made available for people who are homeless with no recourse to public funds. Helping them with shelter at this time is essential for public health and their own safety. Any thoughts on any homeless points that you might be able to make?
It's John here. One of the things that the council I'm working with has done is to phone up hotels and places where potentially we can put people if this gets worse, and prepare for that. But I think the key to that is mobilizing local community groups and actions, especially when you've got villages and towns that actually know their people and know who are those people at risk. But we're expecting a big increase in people who are currently sofa surfing, who are now going to be potentially evicted off their sofas, and we are waiting for that demand, which hasn't yet hit.
Can I just add to that, please? One observation, which I mean, John mentioned the point about needs that will emerge, and I think this homelessness is a need that will emerge quite quickly, and councils will be expected to respond to it in the way that John is describing. I think the other issue that people are talking about a lot is a great increase in domestic violence and domestic violence related issues, and I suspect that one could become quite serious and quite important quite soon.
That was one of the questions from another attendee, Frank, so yes, you're quite right as well. Devon, did you want to add to that before I move on to the last question?
Yeah, I mean, I guess I just wanted to say, I mean, it is an immediate concern. So it's one of those, rather than it will be an ongoing emerging priority, I guess, but it was the #1 priority that the councils we were speaking with were dealing with in the first few days after this hit. I don't know, and I can't neatly summarize what their solutions to that were. But again, I suppose that's the benefit of being on a webinar like this or joining the LIFT community, is to be able to share what others are doing, what you're doing, and share strategies as they evolve. And Frank, I think, shared some links on what on resources they've got in place to kind of bring people together as well.
Brilliant. Okay, and this is going to be the last question. I do apologise to everybody that I've not got to. As I said, you will get a response separately offline. But finally, this delegate has said, this has been a really useful webinar. Thank you. Well, thank you. I just wanted to get your thought on supporting our volunteers as well. We support many vulnerable clients, but also have volunteers who may also need some support too. I know you touched on volunteers, Frank, in your piece. Is there anything more that you could add?
I think there is, it's a fair question to which I don't have an immediate answer. I think the thing that I'm struck by, as I say, is the huge numbers of people that want to volunteer in this situation, and what feels quite a complex volunteering landscape, whereby there are various national schemes, various local schemes, and you know, there's a huge NHS response from yesterday. So I think there is something probably about working more closely with particularly the Red Cross and NAVCA, who have set up national schemes, because this is one of the things that they do, is work with volunteers. So I think it is probably not, potentially not a matter of reinventing your own volunteering scheme, but it might be linking into the national things that are scaling up now.
And this is John here. Just a quick feedback. Have a lead that takes care of volunteers, and that lead will phone them up at the end of the day, or whatever it is, ask them how they're doing. But in particular, ask the question, what can we as a council help you to do better or help you with? And you'll get the answers to that question.
And if I can just come in at the end, I think there's we've seen it in the work before this crisis hit, in the work we've done with the local authorities, but shifting toward that approach that I think Frank talked about with his colleague's elderly relative. It's not about, it's being human. So when you do talk to volunteers, or you do talk to your service users, it's about talking to them as an individual, saying, what do you need? How can we, you know, is there anything you need? Do you just need a chat? Would you rather I call back later, or didn't call again? You know, just let me know that you've got the support in place. People to people, and that kind of human interaction, and building that community, which I think is what people will be missing because they won't have their older communities. Keeping it simple like that is, I think, a really good good thing to instill amongst your particularly your staff who are being who want to contribute.
Excellent, thank you very much. And as I say, I'm going to get answers to all of the questions that were posed that we didn't get to. But just to finish up on this page here, in terms of tools that can help. I know this has been touched on during the webinar, but I just like to leave this with you. So for up-to-date information on the welfare support available, Devon talked about this. We are updating this page on a regular basis, many times a day in some cases. So do feel free to link to this page. I know that was one of the questions actually. Feel free to link to this on your own website. The wider this gets shared, the better. We just want this information out there because it's important, and our policy experts are all over this, and this is their input. So please do feel free to share that on your own websites. The basic benefits calculator that we produce is listed on gov.uk, and it's free. That's our basic version. Whilst it doesn't necessarily have the built-in features to help all frontline advisors give the support that you need to give, it is as accurate as our advisor calculator, and it is simple to use. So there's a link there, and again, please do feel free to put that on your website as well if you're not already a benefit and budgeting calculator client. Devon talked there about the self-serve calculator. If you are a benefit and budgeting calculator and you've not yet been in touch with us about putting the self-service link on your website, then please do. And just finally, we have a follow-up email with the webinar recording and slides that's going to be coming out to you this afternoon. There is a very short survey to follow when we close this webinar. I'd really appreciate your feedback and your thoughts, and indeed what more you think we could be doing to help you in these times. And as I mentioned right at the very beginning, we have a next webinar coming up on Wednesday, the 8th of April. That's with our Head of Policy, Zoe Charlesworth, really going through all of the changes that have been made to the welfare system so far, and how they can help and who they can help. Lots of questions, and no doubt that will be updated with the self-employment information that we're expecting later today as well. So without further ado, Devon, I'll leave it with you to thank our guests.
Yeah, huge thanks, Frank, John, for joining us, and for the conversations before this webinar as well, because I think it is, for those of you, many of you who have joined us today on the webinar, it can be sort of isolating to be trying to think about solutions, either yourself or just within your small network of people within your council or your organisation. It's been really helpful just to think and talk to many of you in the run up to this, particularly Frank and John, who've put some really deep thought into some of the things that are going through local authorities' minds right now. It is unprecedented. It is evolving. So do keep in touch. Our contact details are here. But yeah, my huge thanks to you, Frank and John. And I'll let Frank, I'll let you have the last word. Right, thanks for giving us the opportunity to talk this through. It's an emerging thing. I don't think anyone's got all the answers, but I think these kind of discussions are critical to moving this forward. So thank you.
Great.
And John,
thank you
here,
very
it's
much.
been really good.
Sorry, John. Yeah, thank you very much. Thanks, Frank, John, and Devon. And please, everybody, do look out for the follow-up email with the links and the recording. And as I say, the webinar will close now, and the survey will come onto your screen shortly. Thanks, everybody. Hope to see you again soon. I hope you've enjoyed today. Take care. Bye-bye now.
Bye.